Impulse control disorders represent a significant category of psychological conditions characterized by an individual's inability to resist urges, temptations, or impulses that may cause harm to themselves or others. These disorders are particularly challenging as they involve a complex interplay between conscious decision-making and unconscious or automatic responses. At their core, individuals with impulse control disorders experience an escalating tension or arousal before committing an impulsive act, followed by pleasure, gratification, or relief during the act itself, and finally, potential regret, guilt, or self-reproach afterward. The DSM-5 recognizes several distinct impulse control disorders, including intermittent explosive disorder, kleptomania, pyromania, gambling disorder, and trichotillomania, among others. The prevalence of impulse control disorders varies significantly across different populations and demographic groups. Research suggests that approximately 10.5% of the general population may experience an impulse control disorder at some point in their lifetime. These conditions often emerge during adolescence or early adulthood, though manifestations can appear at any age. Particularly concerning is the high comorbidity rate with other psychiatric conditions such as mood disorders, anxiety disorders, substance use disorders, and personality disorders, which significantly complicates diagnosis and treatment approaches. The neurobiological underpinnings of impulse control disorders involve dysregulation in several key brain regions and neurotransmitter systems. The prefrontal cortex, responsible for executive functions including impulse control and decision-making, shows altered activity patterns in affected individuals. Additionally, dysregulation in dopaminergic and serotonergic pathways appears to play a crucial role, with dopamine associated with reward-seeking behaviors and serotonin linked to inhibitory control. This neurobiological perspective helps explain why these disorders often respond to certain pharmacological interventions targeting these specific neurotransmitter systems. Genetic factors significantly contribute to vulnerability to impulse control disorders, with heritability estimates ranging from 40 to 60% for conditions like pathological gambling and trichotillomania. Family studies consistently demonstrate increased rates of these disorders among first-degree relatives of affected individuals, suggesting a strong genetic component. However, environmental factors also play a critical role in the development and expression of these conditions. Early life trauma, inconsistent parenting styles, exposure to violence, and chronic stress all contribute to increased risk, highlighting the complex gene-environment interactions that ultimately shape an individual's susceptibility. The diagnostic criteria for impulse control disorders typically involve recurrent failure to resist impulses, increasing tension before acting, gratification or relief during the act, and possible regret afterward. Specific disorders manifest in distinctive ways. Intermittent explosive disorder involves disproportionate aggressive outbursts. Kleptomania entails recurrent failure to resist urges to steal items not needed for personal use. Pyromania involves deliberate fire-setting for pleasure, and trichotillomania features recurrent hair-pulling. Assessment typically requires comprehensive clinical interviews, psychological testing, and sometimes neuroimaging to rule out other conditions with similar presentations. Treatment approaches for impulse control disorders typically involve a multimodal strategy combining psychotherapy, medication, and supportive interventions. Cognitive behavioral therapy, CBT, has shown particular efficacy, helping individuals identify triggering situations, develop alternative coping strategies, and restructure maladaptive thought patterns. Specific techniques such as stimulus control, response prevention, and skills training for emotional regulation prove especially beneficial. Dialectical behavior therapy, DBT, with its focus on mindfulness and distress tolerance, offers another evidence-based approach, particularly effective for disorders involving self-harm behaviors. Pharmacological interventions for impulse control disorders typically target the underlying neurotransmitter systems involved. Selective serotonin reuptake inhibitors, SSRIs, have demonstrated efficacy for several impulse control disorders, particularly trichotillomania and compulsive buying disorder. Mood stabilizers like lithium and anticonvulsants show promise for intermittent explosive disorder by helping regulate emotional volatility. For gambling disorder, Opioid antagonists like naltrexone have proven effective by blocking the pleasure response associated with gambling behaviors. However, medication responses remain highly individualized, often requiring careful titration and monitoring. Newer therapeutic approaches incorporate mindfulness-based interventions, which help individuals develop greater awareness of their impulses without automatically acting on them. These approaches foster a non-judgmental stance toward one's thoughts and feelings, creating space between impulse and action. Virtual reality therapy offers promising applications, allowing individuals to practice impulse control in simulated high-risk situations. Additionally, neuromodulation techniques like transcranial magnetic stimulation, TMS, target brain circuitry involved in impulse control, showing preliminary positive results for treatment-resistant cases. The impact of impulse control disorders extends far beyond the affected individual, creating significant ripple effects throughout families and communities. Strained relationships often result from behaviors like gambling, stealing, or aggressive outbursts, leading to broken trust, financial hardship, and social isolation. Legal consequences frequently accompany disorders involving stealing, property destruction, or violence. Financial devastation commonly results from gambling disorder, with affected individuals accumulating substantial debt. These wide-ranging consequences underscore the importance of early identification and comprehensive treatment approaches. The prognosis for impulse control disorders varies considerably depending on factors such as disorder type, severity, comorbid conditions, and treatment compliance. With appropriate intervention, many individuals achieve significant improvement, though complete remission may not always be possible. Recovery typically involves ongoing management rather than a definitive cure, with relapse prevention strategies playing a crucial role. Protective factors for positive outcomes include strong social support, early intervention, consistent treatment adherence, and development of robust coping skills. Even in chronic cases, harm reduction approaches can substantially improve quality of life and functional capacity. Prevention and early intervention strategies for impulse control disorders focus on several key areas. Early childhood interventions that promote self-regulation, emotional awareness, and healthy coping skills lay important groundwork for impulse control development. School-based programs teaching social-emotional learning have demonstrated effectiveness in reducing impulsivity and associated problems. For at-risk populations, targeted interventions addressing specific risk factors show promise. Public awareness campaigns help reduce stigma and encourage help-seeking behaviors. By implementing these preventive approaches alongside effective treatments, we can substantially reduce the personal and societal burden of impulse control disorders, moving toward a future where affected individuals receive timely, compassionate, and effective care.